Hello, my name is Dr. Drew Sutton, and I want to show you something that few people get the chance to see. This is a pair of 2,500-year-old teeth from one of our ancestors. It looks like this after being buried deep in the mud for centuries and accidentally excavated by heavy machinery. Not even a small cavity or crack, even though toothpaste, brushes, or dentists were inexistent back then. Now, these are the teeth of a 45-year-old patient who brushes every day, never misses a dentist appointment, and eats sweets only on occasion. So how come teeth can thrive for thousands of years outside of the mouth, covered in dirt and worms, while in the mouth they get ruined by plain chocolate? I can tell you now it's not genetics, nor how healthy you are. It has nothing to do with what you eat either. Instead, it has everything to do with something you are using every single day, thinking it keeps you healthy and safe, when in fact, it's getting inside your gum pockets, eating at your teeth, putting you at risk of throbbing pain, inflammation, and infections, while also making you prone to allergies, clogged sinuses, headaches, or gut issues. But once you'll find out what it is, you will finally be able to quickly start rebuilding your gums and teeth, stop the bleeding and the itching once and for all, while forgetting all about bad breath, cavities, and yellow teeth. Not only that, but you'll also be able to breathe better, clear your throat and sinuses, and enjoy a perfectly smooth digestion. It enjoys the good oral bacteria and doesn't allow the strains to grow back? After digging even deeper, I found the shocking answer. It's the very things that promise to save you from it. Dental products and procedures. Our teeth are constantly under the attack of the dental care chemicals. For example, let's take the most popular dental care product, the toothpaste. Did you know a lot of toothpaste brands are detergent-based? That's right. These toothpastes are trying to remove grime off your teeth by the same aggressive procedures that bleach removes stains off your white t-shirt. Sure, the stain is removed, but also the fabric is weakened. Tens of studies have proved that a lot of big oral care brands contain hidden chemicals, but they have been ignored or worse, buried by corporate lawyers willing to protect the profits. Do yourself a favor today. Check all the products you use and immediately throw away the ones that contain one or more of the following ingredients: sodium lauryl sulfate, SLS, sodium fluoride, triclosan, artificial sweeteners such as sodium saccharin, aspartame, xylitol, and erythritol, artificial color dyes, often made from coal tar, propylene glycol, diethanolamine, DEA, microbeads, tiny solid plastic particles. The good bacteria is always trying to repopulate, but using these oral care products is like pouring bleach in your garden and expecting to get nice plants growing there. The bacteria just never grows in a balanced way. Sometimes one bacteria strain might grow, sometimes another, sometimes a third. But the problem is healing bacteria strains can't grow all together at once for months in a row and support each other in creating a varied, safe flora for your gums and teeth. If that wasn't enough, some toothpastes use abrasives to be effective. The abrasives used, such as hydrated silica, are too rough. These ingredients can strip away the enamel, creating sensitivity and gum recession. Don't rely on your mouthwash either, especially if it contains alcohol. In fact, honest dentists don't even recommend mouthwash as part of a daily dental routine because many brands have an active ingredient called chlorhexidine that wipes out beneficial microbes. A 2020 study showed that healthy people who rinsed with chlorhexidine mouthwash experienced more acidity in the mouth and were more inclined to higher blood pressure. Considering all these, the immune system of your mouth, the oral flora, is almost non-existent. The result? You get cavities, inflamed gums, bad breath, and eventually lose your teeth. So what can you do? Should you stop washing your teeth and never touch toothpaste again? Certainly not. Toothpaste has its undeniable benefits. It helps remove part of the plaque and its bacterial buildup on teeth. If you use a natural toothpaste, one that does not contain chemical ingredients, the damage to the good bacteria is minimal. But even if you choose the best non-invasive dental products starting today, the bacteria strains are still incredibly weakened and need time to recover. However, there are two factors that make it hard or even impossible for this to happen. First one is stress. Stress causes a major decrease in salivary flow. Saliva is the lifeblood of the mouth. Stress, together with the lack of good bacteria, causes a shift in the pH to a more acidic environment that corrodes the gums and promotes unhealthy grinding and clenching of teeth and jaw discomfort. Grinding or clenching puts an enormous amount of pressure on the teeth and can often cause a tooth to become loose, especially when there's an underlying problem like infection or decay. So while you sleep, there's a risk of losing one of your teeth. The second culprit is salt. Your gums are like the skin. They can peel, become dry or loose, get inflamed, crack, or change color. Too much salt will cause dehydration, dryness, bleeding, and receding gums. And today's processed foods are loaded with salt. Before telling you the only method that can rebuild the mouth microbiome, here's a quick tip to help you remineralize your gums and teeth, at least temporarily. Chew sugar-free gum. If you're still in doubt whether your oral microbiome is poor and you lack good bacteria, all you have to do is answer one of these questions. First question: have you ever woken up on different days with either a dry mouth or drooling on the pillow, or a stuffy nose or a dry throat? And the second question: do you also have digestive issues, like bloating or IBS, or are you also dealing with allergies and or headaches? If you answered yes at least once, this is proof that your oral flora is out of balance, and your gums, teeth, and the rest of your body are constantly under attack with very little protection. I mean, just imagine toxic chemicals viciously corroding at your teeth, burning your gums while destroying every single strain of bacteria, allowing germs and viruses to multiply by thousands every single second and crawl up your nose and down your throat, causing inflammation, irritation, and pain, affecting your brain and digestion, leaving you prone to allergies. I know this is a pretty intense picture, but it is extremely important that you see and feel what exactly is happening at this very moment, not only to your gums, but also to your entire body.